This video is going to go over the proper way to take blood pressure. Blood pressure is an important skill commonly used in many cardiac rehab programs, but is useful throughout the health fitness field. This video will provide the tools to accurately take blood pressure both at rest and exercise. In this video, we'll be going over how to properly choose a cuff size and its placement, how to position yourself and the patient, how to identify and accurately interpret a blood pressure, and conclude with common mistakes that could create inaccurate blood pressure readings. The first step is selecting a cuff appropriate to the size of the patient's arm. The clinician should be positioned next to the patient while supporting their arm at heart level. The cuff should be placed approximately 1 inch above the crease of the elbow. The bell of the stethoscope should go over the brachial artery. The clinician should then pump the cuff to at least 160 at rest to occlude the artery. You may need to pump the cuff up more, specifically when working with hypertensive patients. After, begin to release the knob, allowing the needle to fall 2 to 3 millimeters of mercury per second. Systolic pressure is determined by hearing the first heartbeat. Diastolic pressure is determined by the last audible heartbeat. According to the current ACSM guidelines, a normal blood pressure is less than 120 over less than 80. When measuring blood pressure during exercise, a similar setup applies. However, when pumping up the cuff, you now need to go higher than 160 due to the increase in systolic blood pressure during exercise. Another consideration to account for is the safety of the patient. Always make sure the patient is supported and not at a risk to fall. In cardiac rehab programs, there are typically 3 blood pressures taken during a session: a resting, an exercise, and post-exercise blood pressure. Now we are going to look at an example of a post-exercise blood pressure. But wait, did you notice several mistakes made? The clinician didn't wait an appropriate amount of time after exercise. As you can see, he is still breathing hard, which will cause an inaccurate blood pressure. The patient then crosses his legs, which can also result in an inaccurate blood pressure reading. The clinician did not properly support the patient's arm underneath his elbow. This then forces the patient to actively hold up his arm, resulting in an elevated blood pressure. By following the steps presented in this video, you will be able to accurately take and interpret blood pressure at rest, exercise, and recovery. Some things to always keep in mind: keeping the arm extended at heart level while always supported, using the right cuff size and proper inflation methods to make sure you are accurately hearing the systolic and diastolic blood pressure, and then finally making sure the patient is fully recovered before taking a recovery blood pressure. Thank you for watching this video. If you are interested in learning more about the research behind this video, here are some of the studies and articles that drove the research.